Reports coming out of the Georgetown Public Hospital's Oncology Department indicate that the majority of persons currently receiving treatment for cervical cancer were diagnosed in stages 2, 3, and 4. According to the science surrounding the disease, a woman will not experience symptoms related to cancer of the cervix in its early stages, but as it progresses, the most common symptoms would include abnormal vaginal bleeding during or after sex, between periods, or even after going through menopause. Dr. Latoya Gooding, an oncology registrar at the Georgetown Public Hospital's Oncology Department, opined that one possible way of addressing late diagnoses would be for women to be cognizant of their individual risk factors for developing cervical cancer.
If you know your risk factor, then you know how to protect yourself. And one of the biggest risk factor again is the HPV virus. So doing the routine screening, you know where you fall, what's your risk, if you have it or not. Likewise, women who have many children, 7, 10 children, they are at a higher risk of getting cervical cancer. Women who are smokers are at a higher risk of getting cancer. Women who have unprotected sex, women who change their sexual partners very frequent, or even women who are immune suppressed, meaning the women who are HIV positive, they are at a higher risk.
Dr. Gooden explained that all treatment options for patients diagnosed with cervical cancer are free of charge except the radiotherapy, which is currently being offered by the Cancer Institute of Guyana at a subsidized cost. She highlighted that patients who cannot afford the radiotherapy can arrange for the government to cover the cost of cancer care.
There's also other alternatives where patients who are really unable to do so, the government steps in and they subsidize the whole thing. But we have a process where they would have to go through, and then they'll assess the patient, and then they would make the decision. They would have to come through here first, or our Guyana Oncology Department of the Georgetown Public Hospital.
The existing treatment regimen for cervical cancer includes surgery to remove the cancer tissue, chemotherapy, the use of special medicine to kill the mass, and radiation and concurrent chemotherapy, the use of high-energy ray to kill the cancer.
Stage 1, you can either go for surgery or radiotherapy. And when I say radiotherapy, they have two types practically, which is the external beam radiotherapy with the concurrent chemotherapy, and the brachytherapy, which is also known as the internal radiotherapy. For stages 3 to 4, we can no longer do the radiotherapy. That's when we can do the chemotherapy by itself, which is actually systemic, and try to either reduce the size of the mass or try to prolong the person's quality of life by trying to get rid of the cancer.
Factors such as the stage of the cancer and the patient's response to the treatment recourse influence its duration. Temika Rodney reporting for the HGP Nightly News.